conventional medicine, we use surgery, radiation, and hormone therapy when we're treating prostate cancer. That's the standard of treatment. And in fact, using other treatment in California is a felony. It's a loss of license, a fine, and even imprisonment, potentially. And actually, there are other things that we can do to treat cancer that are very important that should be considered. Things that are related to lifestyle. There have been some interesting concepts that have changed the way we think in healthcare, in medicine, in the last couple of years. The whole story of epigenetics by Bruce Lipton in his book, The Biology of Belief, tells us that DNA is not immutable. It is not fixed. It can be changed, and it is responsible, or is responsive to, what happens in our environment. So we now know that we can do a lot of things to change the DNA that we have in our body that may be abnormal. The Dean Ornish study that was recently done on people with prostate cancer that was a stage 6, basically was a Gleason stage 6. There are scores between 6 and 10. 6 is one that's relatively benign, meaning that we can watch and wait, see how things go. A few of those people will actually get invasive cancers, but the large majority of them won't, and that's why we watch and wait. Well, Dr. Ornish had a large group of patients, say 300 patients in his study. Half of them, he went ahead and he actually biopsied them all at the beginning, but half of them he followed by a biopsy at the end of the study when he did nothing further to them over that 3-month period. And as you'd expect, there was no change in what the cells looked like, and they still had Gleason 6 cancers. The other 150 patients, they biopsied, found the Gleason 6 at the beginning, but then they did some interesting and novel things. They changed their diets. They exercised them. They did yoga. They did things that were group support. They did a lot of things that changed how they lived their lives. And when he re-biopsied them at the end of the 3-month period and looked at the 500 oncogenes or cancer genes that were involved in the Gleason 6 cancers, they had turned off. In the control group, they were still on, they were still causing the cancer, but in the group that had been treated with lifestyle, they were turned off. That tells you that there's a lot you can do with lifestyle. If we had a pill that did that, if Big Pharma developed a pill like that, it would be a blockbuster. There are other things that work besides just lifestyle that I've mentioned. There was a study presented at the ASCO conference, the American Society of Clinical Oncology, a couple of years ago, and the big hurrah at that particular conference was that flaxseed oil by itself seemed to change the person's risk for getting cancer and for its development. So that's something that should also be considered as an approach that can change our cancer. Vitamin D deficiency is another issue that we have to take into consideration. There's an epidemic of vitamin D deficiency because we don't get in the sun between 12 and 2, which is the only time the UVB rays that make vitamin D are there. So if we're not getting any sunlight and our levels of vitamin D are low, how does that impact prostate cancer? Simple. It basically says that cells that are already abnormal are going to continue to be abnormal and not have any course that's changed. But if you replace the vitamin D that they need, you can cause those cells to redifferentiate sometimes. You can also increase the levels of natural killer cells because it shifts the production from antibody production to natural killer cells. And the natural killer cells are what are important in the immune defenses against cancer. Our exposure to toxins is another place we clean up our environment so that we're not exposed to so many of those toxins that make the cancer occur in the first place. So lifestyle effects on cancer are huge. We've mentioned a few, but there's also other dietary approaches that are important. Exercise, stress reduction, getting enough sleep. We know that getting enough sleep is absolutely critical in preventing all-cause mortality. When the American Cancer Society studied lifestyle factors including sleep, cigarette smoking, exercise, stress, etc., they found that what predicted all-cause mortality more than anything else was less than 4 hours a night of sleep. So there's a lot we can do If you have a Gleason 6 cancer, or maybe a ductal carcinoma in situ cancer, or another early cancer that's not really one that has to be treated, this is a time to get more aggressive and do these lifestyle approaches. But it's also time for all of us to think about doing this, because what we should be interested in is not so much keeping cancer from killing us, but keeping us from getting it.